Hi class, welcome to video snippets of coronary. And so first let's talk about coronary circulation and conduction. I think that I sent you a video of like the coronary circulation, but there's a couple of things that I drew in class that I wanted to kind of reiterate for you. And so let's see now if I can actually do better at this diagram here. So here, just hang tight for a second. Okay, I think I'm doing a good job here. There we go. Here's a nice little heart here. I think the one thing that I wanted to reiterate the other day was talking about the left main, that there is such a thing as the left coronary artery coming off of the aorta. And so like here, this is the left main. And the idea that I told you why it was important is that, at the very beginning, this is the main one that actually feeds, the circumflex. It actually feeds all these little blood vessels coming down, And so here is like the left anterior descending. You don't need to know all the vessels, because here is the left ventricle. Right, here's the right ventricle, here's the right atrium somewhere, here's the left atrium somewhere, and then I'm not drawing it out, because what I want you to see is here's this left main, as you can see, feeds off other major vessels, because there's also another vessel that wraps around here, but this left main, you can imagine that if you had some sort of blockage here, that would really be a very that would be detrimental, because this feeds all these other vessels. And so if for some reason there was a problem where there was a big blockage here, you actually would be decreasing the coronary supply to the rest of the heart. And so this is going to be that is going to cause a huge problem as far as like perfusion deficits. And so understand that, that's why I drew out the left main. The other part is the coronary conduction system. So somewhere like here is we're going to draw it in a different color, is the SA node, so then somewhere right between the atrium and the ventricle is the AV node, and then somewhere maybe right here, so you start here is the bundle of His, which you need to know. And then, it goes down to these bundle branches. So this one is bundle branch. And then it kind of depolarizes around to the bundle branch, to the Purkinje fibers. So you just remember, that here is the electrical conduction system. It always starts here, your intrinsic pacemaker, to the AV node, to the bundle of His, to the bundle branches, all the way to the Purkinje fibers. Now recall what I said is that what happens is that they all start to correspond with one particular coronary circulation, right? So, when you look at this, let's look at what each of these mean. Wait, hang on. So here you got a P wave. Here is the PR, right? Here is QRS, and then here, all the way, is QT. And so you have to really understand that, when you actually depolarize, which means you contract and then you relax, what does this all mean? So the P wave represents atrial contraction. The PR is atrial contraction and relaxation. And then you have QRS, which is ventricular contraction Okay, then from the beginning of the T, so QRX including all the way to the end of the T wave is ventricular contraction and relaxation. Okay, and then somewhere here, this is important, okay, because when you have a relative refractory and an absolute refractory period, what does this really mean? Okay, in the relative, hence, you know what? Think about relative. When your relative comes to visit you, you know what? You're gonna take attention away from you. That's kind of how I think about it. Because when your relatives come, you want to socialize, you want to go places, and so you know what? They can take you away from like the direction. So if you decided that you were gonna you wanted to clean your house or you want to get something done, well, when your relatives come to visit you, you can't really do those things. You kind of have to entertain them, right? So if you think about it that way, what happens if you have an impulse that kind of hits that area, you start a new rhythm. Like, you can start a new rhythm. What happens is that it will respond. Okay, in the absolute, you think about you saying, okay, absolutely not, is what I think about. In the absolute refractory period, nothing happens. So let's say you have a diseased heart, and then even though the SA node is the intrinsic pacemaker, so SA node has an intrinsic rate of 60 to 100. The AV node is about 40 to 60. And then you'll go further down to like, okay, the branches and the fibers, like you shouldn't even get to that point, somewhere like 15 to 30. Whichever one, like let's say the primary pacemaker is sick or fails, the next one takes over and it keeps going, right? That's why they say like in vital sign, you have a normal heart rate of 60 to 100. Now, okay, but let's say you have a diseased heart somewhere, and let's just say that all of a sudden your primary pacemaker, see, I'm really, really proud of my heart. Your primary pacemaker, okay, fails. Or let's say it's working, but it's sick, and then, you've got a diseased heart that just decides that, oh, well, you're going to fire an impulse. If you fire in the relative refractory, so this is when the ventricles are starting to relax, but it's not relaxed all the way. It can respond to a stimulus, okay? So if, you're about to, rest and you're about to clean your house, well, your relative shows up all of a sudden, well, you're going to kind of have to divert your attention, right? Like, let's say, versus, like, you're kind of, you get to this absolute refractory period and you're dead set on something that you have to do, and you know what, it doesn't matter what anybody says, you absolutely are going to say no. You're going to set your boundaries. You're going to say, in other words, nothing happens. So let's say that another impulse gets generated, or an electrical signal, that's what an impulse is, gets generated. They hit this absolute refractory period, the heart will not respond. Like, because it's literally almost all the way contracted. That has everything to do with, okay, when sodium and potassium pumps have exchanged, remember we said that the gates have to open. So if you recall, you have potassium inside the cell, which is a negative charge, right? And you have sodium, right? And so when you actually are about to send an electrical signal, you actually have to, you change the charge, okay, to become more positive. And what happens is that you open the gate and they exchange electrolytes, right? That's why the electrical signal starts, okay, and it actually goes through a contraction. And then we're talking about milliseconds here. But then what happens is that when the ventricles are getting ready to relax, okay, it goes back to what the normal is. So for example, okay, you open up the gates, sodium goes in, potassium goes out, you contract. When you actually are about to relax again and start all over, it restores the normal charge. So it closes the gate. Once you close the gate, here, that's why you call it the absolute refractory period, like the gate is closed. Like, you can try and enter and do whatever you want, and it's not going to work. So if you think about, okay, relative coming to visit you, they're going to disrupt kind of like your day. If they show up, especially unannounced, right? Absolute, think about it, gate closed, right? Like, the the word no, right? You set your boundary. The gate is closed. You can't do anything to me. All right, thank you. That concludes this piece for coronary circulation and conduction.